Okay, it's 6:30. Call to order the October meeting of the Sawyer County Health and Human Services. Roll call
Dale Schlueter,
here.
Kay Wilson, Marshall Savitsky, Michael Maestri,
Here.
Chris Rusk,
Here.
Lorraine Gouget, Dawn Pettit,
Here.
Carol Pearson, Sabrina Dunlap. You have a quorum.
Okay. Pledge of allegiance, please stand.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Madam Clerk, certification of compliance with open meeting laws.
This meeting has been noticed to the public and news media as required by section 19.84 of the Wisconsin statutes.
Okay. Meeting agenda, any changes to that? Okay, let's move on. Public comments. Do we have anybody present that wants to do public comment? Nobody online?
Do we have to put the last meeting, do we have to vote on that to put agree to it or no?
Say what?
The minutes will be coming up next, I believe.
Okay, so nobody for public comment. Okay. Nobody for public comments? Okay. Consider approval of minutes from previous meeting. Thank you. I have a motion to approve in a second. Any discussion? All in favor, say aye.
Aye.
Okay. Moving on. Come on. Committee reports. We still don't have an LCO liaison, do we?
Thank you.
Okay. Senior Resource Center.
What we have there is a fundraising report for the Senior Resource Center. It's total to date of $12,677.
I don't know who that is, but please turn down your volume and mute.
Okay, there it is. I've heard today that we're up about 3,000 or 4,000 more as of today. The Senior Center has been working on with Andy a little bit on trying to get some help or some assistance or ideas for delivering meals, and that's about all that we have to report.
Okay, thank you very much. Liaison, Senior Resource Center. Andy, you've got the grant.
Yeah, so every year the county sponsors the grant application to the DOT for Section 8521. I believe this is referred to as the bus grant, the transportation grant. So this is authorizing the annual application. The money flows through the county to the to the Senior Resource Center for transportation.
Okay, and this is a resolution, so we need a vote. Do we need?
I'd make the motion to approve the resolution.
Okay, we have a motion and a second. Any further discussion? Is this going to be just by a show of hands or? Okay, everybody in favor, say aye, please.
Aye.
Anybody opposed, same sign. Okay, motion passed.
Chairman, this is Dawn Pettit. I got booted off. I had a question for the SRC.
Okay, go ahead.
I'd like to find out why it's a recurring issue that the drivers are not being paid for the Meals on Wheels. And my understanding is that now the county is going to advance the money once again to SRC to pay the drivers. because I guess there's not funding between Guar and something else is going on. But I would ask for a accounting of how many times the county has had to give money to the Senior Resource Center for this issue and why it is a recurring issue and why we're not contracting with the other committee, or not committee, the other partnership.
We met with Senior Resource this week because we heard that as well. The drivers have been slow to get reimbursed because Guar has been slow to reimburse the Senior Resource Center. So we did talk to them about if that's the case, we want to keep the drivers as current as possible, that we would look at how to advance money to Senior Resource. And then when the reimbursements received from Guar, we would be reimbursed. I can't speak if that's been a common thing. I know it hasn't been a thing in the last couple of years where we've had to do that, but I know reimbursements from Guar or the state have been slow to get to the Senior Resource Center.
They were very slow last year, and I think even slower this year, so that may be why it popped up now.
Yeah, and we have noted in a number of our contracts with the state that they're very far behind.
I'll just continue on. Like the other issue is that Senior Resources have some gaps in having drivers to deliver Meals on Wheels or meals to the congregate or to congregate locations. And so we did, like Lynn said, are talking about ways to help back them up.
Okay. Any further comments? Okay. Go ahead, Andy.
I think the next one would be administration. I'll turn over to Julia.
Oh, I'm sorry. Yes, please. Sorry, Julia.
Okay. Well, one of the things that we have is we still do not have an LCO liaison. Mr. Rusk, if you are able to help us be able to identify who that could be, we'd appreciate that.
Right. I did talk to Tweed about that. He told me they were identifying someone, but I haven't followed up. I will do that.
Okay. Thank you. We'll keep, maybe both of us can keep moving that forward.
Yeah, I'll shoot him a text right now, actually.
Okay, thank you. The other thing that we have outstanding is a few positions. One of the things that is currently happening with the adult long-term care is that Hank Hannes, who was the disability benefits specialist, is transitioning into the elder benefits position, which we did talk about before. He now should be into that role full-time, which will allow Carol to transition fully into her supervisor role, along with being able to assist with the APS, which she was not able to do until she was out of the elder benefit position. The other thing that is happening with the adult long-term care unit with positions is we had a fiscal position, or a fiscal or clerical position, actually, that was half-time clerical there, and also half-time with the vet's office. Nicole has now transitioned over full-time to support the vet's office. So we'll be looking at replacing that position so that we have somebody at the front desk. So we're working on transitioning what that looks like, maybe even kind of reconfiguring our positions as we move forward here. Behavioral health position, we still have the opening for the therapist. We're looking at creative ways of being able to move forward in maybe contracting for services or working with other counties to determine how we can best do that. CPS, we still have the open supervisor position, still actively looking at that. And in public health, we have a position for clerical support that would go along with some of other fiscal or other clerical support roles. And again, as we process through everything, we'll be looking at how we can best fill that position too. Some of the key priorities that I'm working on right now is with Joe and Alicia, we're looking at CPS, CCS, mobile crisis, what are our immediate needs, our long-term needs, and looking forward to connecting with Northline Counseling and what those new contracts will look like as we transition after Carol's passing. Also, the next thing that we'll need to get done is finalizing our updated fee schedule, which will need to come to this committee next meeting. So plan on the fee schedules coming through. And again, when that comes through, it will be an updated fee schedule for the tourist rooming housing along with all of the other licensing fees that we do with the agent program. And note that that has nothing to do with what is happening right now with the tourist rooming house discussion. We just need to make sure our fees cover our costs as we move forward. The other things that I'm working on is continuing to work on the employee engagement and get on the build on the momentum from our last all staff meeting. And we are almost done with getting everybody moved and retransitioned within the department and getting things cleaned up. So that's what we've been up to most recently. So any questions on that?
No. I don't see any hands, so go ahead.
Okay. Keep moving along. Adult long-term care unit, things to highlight on there is on page 17 and 18, there's a list of resources along with caregiver training that will start on the 16th. So share that with people that you know. And the other thing that we need to work on is we have not really done an open house since they've moved to the new building. So we'll be actively planning an open house. I'd like to get that scheduled before the snow falls so that people can get out and get over there. So that is on the agenda to happen soon. We don't have a date scheduled yet though. Any questions on adult long-term care as you look through the report? Okay, moving on to behavioral health. I see Alicia is on. If there are some things you want to highlight in your report, Alicia, or anything new to add? I thought she was on. Now I can't see for sure.
Yes,
Oh,
I am
yes,
here.
you are. Okay, just checking.
Yep. I guess really the only thing to highlight would be we did have a meeting today across the state for recertification. DQA, that's Division of Quality Assurance. They're who comes in and does our recertification. They're far behind, and the woman that has been in charge for many, many years, she retired. I just found that out today. So there's a replacement for her, which is kind of backing things up. So they're giving us 3 to 4 month window because usually we already have that renewal done by this time of the year. So I've been worried about that, but was reassured today there was nothing wrong on our part. That was based off of lack of being able to hire employees to fill the positions across the state. So some surveyors are covering multiple counties and they just can't keep up. This has been an issue since they revised Chapter 75 last year. CCS, we recently had one of our providers decide that a contracted provider, that she did not want to continue providing services simply because of the paperwork. She said it was too much. So we lost another provider for that. Our CCS service director for the region, she's taken a different position within Taylor County, so they are looking to replace her. They do have a person filling in for her, but ultimately they want to replace the position with someone qualified for that position as a service director. CST, we finished our 6-month renewal or our review, and we also got in our 2024 grant already. They do both of them at the same time, which makes no sense, but that's just the way they do it for CST. CLTS, we've got numbers usually fluctuate between 46 and 50, and we have our yearly review the first week in December, so we're already starting to work on that. We haven't gotten the number of cases that will be reviewed, but I'm thinking probably between 15 or 20. So this is always the busiest time of year because the grants are due, research are due, reviews are due. So September, October, November is pretty busy for us. That's it. If anybody has any questions, I can answer.
I don't see any hands up or anything.
Okay, thank you, Alicia.
Okay, sure.
Alicia.
Sure.
Okay. Child Protective Services, right now, Season, who is our contracted part-time supervisor, is in town. And she'll be meeting with staff for the next, well, today and the next 2 days. Tomorrow, the Department of Children and Family Services from the state level will be here for our triennial visit, so we'll be meeting with them. One of the things that I've got on my docket is a meeting with our judges to really talk about child protective services and youth justice to make sure we have everybody kind of moving in the same direction as we move forward, not only with the new staff in our department, but also changes with the courts as well. So just want to make sure that we're all on the same page there.
Have they been amenable to getting together?
Yes, actually, they've invited me to come to the meeting. So
Right.
there we go.
Good.
So very, very much so. And any questions on child protective services? Otherwise, I'll go right into youth justice because it kind of is merging together. With that, the courts in trying to work through the youth justice cases and really truancy and what does that look like when people when kids are truant, how does that work through the court system? What does that look like? Does it really meet youth justice and need to be under that field or not? And kind of looking at what does that look like? How do we move forward with fines? What do we ask families and youth to do? And what level or degree does that make it into the youth justice category? And so we met last week with Judge Isham along with Hayward School District and LCO and Mike Kelsey, and really started talking through that. So that'll be something that we'll continue to work on as we move forward. We've got a meeting scheduled November 7th. We're going to create a steering team or a task force that will move forward and really come up with some good planning of how we can do this as a county. So truancy is something that youth justice is usually not involved with in most counties. However, we know that if kids aren't in school, other not so good things tend to happen and could lead them down the youth justice path. So it's kind of that diversion area. Where do we work into and how do we connect? So also we'll be connecting with Alicia's crew, looking at CST and CCS and other ways that we can have wraparound services with that. So that should be hopefully in the next few months. I do not expect like a major plan to be in place before the end of the school year. We've got some temporary plans to move forward with, looking at being able to have something that maybe we could try out towards the end of the year and be really focused in coming into the next school year. It'll take us a while to develop all those resources.
Julia,
Yes.
what rate of truancy do you have in the school district?
Shoot,
I was
I
gonna
should have
ask
been
this.
coming here with that at my fingertips.
Well, just an approximate, I mean, are there 100 kids? Are there 500 kids?
Oh my gosh. I don't even know. I can't remember the percentage. I think it's like a 26%. If I look at the county, I should have brought the maps with me. I
That's
can
a
bring
lot.
that. I'll bring that next month.
Okay.
I can, because we actually have a presentation that really shows the full state and where each of the counties are at with truancy. And
So
I
if
just
a
got,
child is truant, the parent is taken to court?
well, either the parent, depending on the age, and or the child, and who is the one that actually does get the fine and moves forward with that. So, yep. So we'll talk, I think that'd be a really good one to just do a full discussion on truancy. It can be a 10-minute discussion and kind of give you more information on it.
Yes.
I'd be interested.
Oh, excuse me. So are you thinking of stiffening what's in place?
Looking more,
or more diversion?
more diversion, because we'd rather have the kids coming to school and not dropped out of school. So how do we encourage them to be in school and turn things around? So looking at that pattern of diversion.
When it comes right down to it, if the kid doesn't want to go to school, it's pretty tough to make him go to school.
Yeah.
him or her.
Well, yeah,
I
and
mean, you
and-
get
and
off the
usually
bus
then
and disappear.
they go, yes, and then they usually, so it will be also looking at it from an age factor. So up to a certain age, parents have much more ability to get their kids to go to school. We have young kids that are truant as well. And then, in high school, when they start getting their license or access to vehicles, it's a little bit easier for them to just not show up, and then holding the kids accountable as well. So, yeah.
Mhm. Right.
I'm just gonna say, if you're planning on a 10-minute conversation about truancy, you should plan on a longer one because
We probably should plan on a longer,
like
there's a lot of questions.
it really, I don't want to say it's been ignored here, but because we've only had one judge, it's probably been pushed down as something to address, but they've said now that we have two, because we need to update our truancy ordinances.
Yes.
Right.
And
There's a
also, I'd
lot of
say,
things in there.
look at the rates, like if you look at the schools
Yes.
report on truancy,
Yes.
that's what's on paper. Then there's the kind of the same thing with unemployment rate. There's people who just fall off. The
Mhm.
numbers are off the system, so it's not even a full number when you see what's on paper. Because
Would it be, will there be people from the school to participate in that
Yes,
discussion?
actually, yes, we have the schools that are participating because they're the ones that the expectation is really for the schools to step forward and move forward first before it ever gets brought to a citation. What all is in place there? What do they have access to? How do they work with Mike Kelsey as we move forward? All those fun things. So, and again, we're kind of have a plan to kind of get us moving forward a little bit, but we need to really have wraparound services around these kids to make sure that
Right.
we're giving them the best chance to move forward. So, we'll at least give you a picture of what truancy looks like at the next meeting. And then as we develop that work group and the next steps, we'll bring those back too.
Yeah, I mean no disrespect, but trying to get truants back, and it's like herding cats.
Well, and part of the whole piece is that we need to get established into this early at the young age and not allow it to go so many years too, because that also, it's also a generational piece that we see too, where it's just kind of an accepted thing to not be going to school. So kind of both of those pieces moving together. So part of what we'll be doing is really dealing with the cases that we have right now, but really trying to work with the younger kids and families to make sure that that becomes ingrained of attending school. And how do we connect kids to school? There's usually reasons why they're not coming to school. And sometimes we can identify that. Sometimes it might just be that they're getting bullied on the bus and they don't want to get on the bus. I mean, there's different things to look at. So it's a multifaceted problem.
Okay, thank you.
Economic support is next. And I think I saw Shauna on.
Yes.
Shauna, if you are on, is there
I am.
anything that you'd like to highlight?
As far as changes, we experienced a significant increase in the number of calls our call center is receiving. So in the month of July, we were at 7,778 calls. And for August, you'll see that it was 9,027. With that, the types of calls, now we are reviewing healthcare. We have ended healthcare, and although I do think that DHS did a great job in getting information out to our members, that keep your case updated, there's still just a hard understanding of how they've had the same job maybe for the last 2 years, have been receiving an increase in pay. And now because their healthcare is being reviewed, some of these members are losing healthcare coverage. And so again, lots of media coverage went out, multiple notices in the mail. It's still just hard for people to lose their healthcare. And so, of course, they're unhappy, and this has really taken a toll on the staff. We do have a all-staff meeting. It's virtual this Thursday. I'm going to try to kind of go over just some self-care type stuff. If you need to take a break from the call center, we're encouraging staff to reach out to the direct supervisor or their call center supervisors and ask maybe to be reassigned to document processing or intake and renewal processing of access applications or paper applications, just to get a break, because of course we don't want to lose our well-trained staff because of burnout or just being treated poorly. So that's a focus of ours right now. Other than that, we're just busy and trying to hang in there. Energy assistance, I think I said last month, you know, that was right around the corner, and that did start here with applications. We did some early applications in September, but now that it's gotten a little bit cooler out there, of course, you know, people are thinking about their propane furnaces are being turned on, you know, so we are definitely busy in my corner of the office.
Any questions for Shauna?
No, but I'm glad to hear about the steps she is taking, because you can't help somebody else unless you yourself are healthy and
Right.
vital. Yeah. No,
No, it's no fun to get yelled at. That, I'm not sure if you heard that. Thank you, Shauna.
yes, thank you. Public health.
Okay, as Julie comes up, I have one update that she won't have. We are moving right along with our WIC merger. We're looking at the MOU to get that signed. We have hired on a director for the 4 counties, and it ended up being Rhonda Kleiss, who is our registered dietitian right now that we currently have for Sawyer County. So very happy to bring her on board. She'll be very well versed in our area and is already working with Washburn and Polk County. So it looks like everything is moving forward nicely with that. And then next week and the week after, we'll be doing our management evaluation with WIC. And so this will be the last time we do it as an individual county. And then as we move forward, we'll be just part of the satellites. And then Rhonda will be responsible for the management evaluation. Okay, Julie.
So Julie McCullum, Public Health. I'll just highlight a couple of things from our report. My report, we are in the midst of doing our emergency preparedness exercise, which is a mass flu clinic. We provide that to both Winter and Hayward. So we're in the middle of doing those clinics. Both this week and next week are scheduled. I did want to make mention, just an update on the fentanyl awareness team piece. As of yesterday, over 1,173 individuals have been contacted through the outreach events, and a number, they're happening ongoing, both in the community and schools, in different businesses. And as of yesterday, 660 individuals have been trained through public health efforts to use Narcan. Of that, 512 have been in person. I also wanted to mention that we received notification from State Health Officer Paula Tran awarding our certification as a Level 2 health department. And I believe the letter is...
It's in the packet.
It's in the packet, so you have a copy of that. And in September, we had a number of staff at conferences and trainings, including Environmental Health Conference, the State Environmental Health Conference, a staff member certified in infection control, staff member who was trained in Title 10, and another went to a week-long training for public information officer training. So any questions?
No, but I want to add our congratulations for coming in such a short time, and basically a time of upheaval, and getting your department in the order that it is in, and you certainly deserve a round of applause. Thank you.
Okay. Now we will move on to fiscal, and I believe Patty is on. If anybody has any questions on the budget performance report or purchase services recap. Or Patty, if there's anything that you would like to highlight.
I am here. And we are looking at pretty much on budget through August. Even with a windfall of some past revenues that came in, I think our overall budget for the year will look pretty good. Now that child welfare is fully staffed, they've been, it's looking fiscally hard at work reducing the kids in out-of-home care, working on that reunification because our costs are way down compared to what was projected. Juvenile justice is though still, we already for 6 months, or excuse me, 7 months worth of expenses, we budgeted $100,000 for residential caring centers and we've paid $286,688. So that is increasing, but on the family services side, it is looking much better than it has been. So any questions I can answer?
I guess not.
Okay.
Thank you. Where are we at now? Purchasers, the future agenda items.
I'll bring back information on truancy when we do the youth justice report. So I'll have that on the next one.
Okay.
And we will also do the fee schedule.
On that fee schedule, what happens with the reviewing that is going on now about RBIs in general?
So if there ends up having to be additional services provided either through any of the departments based on what we're seeing, then we'll have to relook at the fee schedule. Right now, we're going to do the fee schedule based on what our expected expenses are. And then we'll have to bring the recommendations forward if there are any changes. The board would still be voting on even moving forward with some of those new decisions. So in general, not just our board, but the full county board.
Yeah, I would almost suspect you would need more help to go to perform more tests, more duties, more investigations, so to speak.
If that is the case, then or we do something different with zoning. But there's so many different options that are out there that we're not going to base our fee schedule on anything except for what we got
No,
going.
I understand.
Yep.
But it's just probably coming.
It's potentially coming.
Yeah. Okay, thank you.
I'm just going to leave it at that for right now because I have no idea what that decision is going to be.
Neither do I. But, okay. Any further?
Oh, yep.
I had one question way back on the mental health monthly expense report. There's something called limitless possibilities. What is that?
Did Joe jump off or is he still on? Okay. And Patty, if you can help me with that as well.
It's a residential placement.
I was just gonna say, and because that one's a higher cost, we needed.
It's huge.
Yes, it is a person that we had to move out of Winnebago and find an additional place of service, and it's a very expensive type of service and placement that we need to have this person in.
Yes, and it's one individual that needs one-on-one or two-on-one.
Yes.
At $1,485 a day.
Yes.
Yes.
Is this a long term?
Yes.
Yes.
Oh, yeah. It's been going on for years.
Yep. The issue that we have is when there's mental health involved at that degree, it's not curable. So.
And how long in a person's life is the county responsible?
Until
their entire life.
I mean, unless they improve, but otherwise it's
Yes,
more likely
unless
until
they approve.
This is not going to improve.
it's not going to go away.
Not this one.
Interesting. Thank you.
Yep. Yeah, you're new to seeing some of these things, so good question. Mr. Rusk has a question. He's got his hand up.
Oh, I just followed up, Tweed followed up with me and another councilman that they had their liaisons on the agenda today, but they never got to it. So maybe tomorrow we'll have it
What?
better for that.
Wonderful. Thank you for the update.
Yep.
It was Joe.
That was Mr. Rusk about the liaison.
Oh, okay. Thank you. I misunderstood. Any other business? We're adjourned.
Okay, thank you.
Thanks, guys.